You know, when you picture a nurse, you probably see the scrubs, maybe a stethoscope around their neck. But what's really going on behind all that? What are the skills, the principles, the things that make up the very soul of nursing? Well, that's what we're going to get into. We're going to peel back the layers and really look at the foundations of care.
So yeah, that's the big question, right? We're going to dive into the systematic, the scientific, but also the deeply human side of what it means to be a nurse. Think of this as a journey, and that journey starts the very first second a nurse meets a patient.
And it all begins right here, with that first encounter. Before a single thing can be done, a nurse has to become a bit of a detective. Their first job is to hunt for clues about a patient's health, and they do that through a really careful and methodical examination.
This detective work really comes down to 4 core techniques that you see here. These are the fundamental tools a nurse uses to listen to what the body is trying to tell them. Let's break down what each of these really means.
Okay, first up is inspection. And listen, this is so much more than just a casual glance. It's a systematic visual exam. But what's really cool is that it's not just about what you can see. A sharp nurse is also using their sense of smell for any unusual odors and their hearing for subtle sounds. It's truly a full sensory observation.
Next, we've got palpation. This is where the sense of touch becomes a kind of superpower. By using their hands, their fingertips, nurses can actually feel for the size, the position, and the health of organs right under the skin. It's like a tactile investigation that tells them a ton of things you'd never see with your eyes alone.
Then we have percussion. Now this one might sound a little weird, but it's actually genius. A nurse will literally tap on the body and listen to the sounds it makes. And those sounds change completely depending on what's underneath, whether it's filled with air or fluid, or if it's a solid organ. It's an amazing way to get clues about what's going on inside. And finally, auscultation. This is the one you probably recognize. It's all about listening to sounds inside the body. And yep, this is where that iconic stethoscope comes into play. It's an amazing tool that takes these faint internal whispers from the heart or the lungs or the gut and turns them into clear information. Now, running alongside all 4 of these techniques is another absolutely critical part of any assessment, checking the vital signs. These are the hard numbers, the objective data that paints a picture of a person's health. And one of the most basic, most fundamental vitals is the pulse.
So, what are we looking for? Well, for a healthy adult who's just resting, the sweet spot is somewhere between 60 and 100 beats per minute. That number is a super important baseline. If it's faster, that's called tachycardia. If it's slower, it's bradycardia. Either way, it's a major clue that a nurse needs to investigate further.
But here's what's so fascinating. Normal changes, like a lot throughout our lives. Just look at this chart. Before you're even born, your pulse is racing along at up to 150 beats a minute. Then it gradually slows down as you grow up, settles into that adult range, and then might slow a little more when you're older. It's a perfect reminder that in healthcare, context is absolutely everything.
Okay, so the assessment is done. The nurse has gathered all this initial data. What happens next? Well, the focus shifts to creating the perfect environment for healing. And that environment is built on 2 pillars: comfort and, above all else, safety.
You know, right at the heart of this environment is something we all know: hygiene. But in nursing, it's seen as both a science and an art. It's all about preserving and promoting health. It's not just about being clean, it's a core principle for preventing disease and helping someone recover.
And nursing really looks at hygiene in 2 different ways. First, you've got personal hygiene, which is pretty straightforward. It's all about keeping the patient's own body clean. But then there's environmental hygiene, which is about keeping the patient's surroundings clean and safe. Their room, their bed, even the air they're breathing. You really can't have one without the other.
Safety also means moving safely. And that's where body mechanics comes in. It's the science of using your body in the most efficient and careful way possible. For a nurse, this is crucial for preventing injuries when they're lifting or moving patients. And for the patient, it means they're being moved in a way that's safe and won't cause them harm. It's a total win-win.
So, we've got the assessment data, we've built a safe environment, but how does a nurse decide what to do next? Well, it is not guesswork, not by a long shot. Every single action is guided by a systematic, logical framework, kind of like a master plan for patient care. And that master plan has a name: the nursing process. Think of it as the critical thinking engine that drives all of nursing. It's a problem-solving approach that makes sure every patient gets care that's comprehensive and totally individualized just for them. And it works in this logical 6-step cycle. It all kicks off with assessment. We've already covered that.
From there, the nurse makes a nursing diagnosis, sets a goal, creates a plan, implements that plan, and then, this is key, they evaluate to see if the plan actually worked. It's a continuous loop, always adapting as the patient's needs change. Now let's zoom in for a second on a huge part of that cycle. A massive piece of the implementation step, the actual doing part, is giving medication. And this is a moment of just immense responsibility, where safety has to be the number 1, 2, and 3 priority.
To guarantee that safety, nurses follow an incredibly strict protocol, often called the Rights of Medication Administration. And as you can see, there are 10 of them. This is way more than a suggestion. It is a non-negotiable safety checklist. It makes sure the right patient gets the right drug in the right dose by the right route at the right time. But it goes even deeper, covering things like the patient's right to refuse and the nurse's duty for right documentation and education. It's an amazing safety net.
We've gone through assessment, the environment, the master plan. But there's one more piece. It's like this constant thread that weaves through every single thing a nurse does. It's the skill that truly holds everything else together: communication.
And we're not just talking about making small talk here. Nursing communication is all about building a special kind of therapeutic relationship. It's a professional connection that's built for one reason: to help the patient. And its entire foundation is built on trust and respect.
And the most important part of this is that the relationship is completely 100% patient-centered. The whole entire focus is on understanding the patient's world, their ideas, their experiences, their fears, their feelings. That is what builds the trust that's so essential for healing to even begin.
So, after all this, after seeing the methodical assessment, the rigorous scientific process, and that deep human connection, we end up back at our big question. Is great nursing an art? Something that comes from intuition and empathy? Or is it a science, built on evidence and process? Or maybe, its real power lies right there in the middle, in that incredible seamless blend of both.